Hello, my name is Kristen Mena, and today I'll be discussing the importance of technical writing for nurses and the healthcare industry. To begin with resumes help employers understand your job experience. It's important to have a properly formatted resume because it helps distinguish you from the many other applicants that companies may have. A resume that hasn't been properly edited may appear messy. Such things can be grammatical errors and run-on sentences and incorrect tense. For example, you would want to use past tense when speaking about previous jobs. Also, avoid using unnecessary words that don't help explain your experience in more detail. In the end, it just makes your resume appear too lengthy. Remember, the interview and resume is your time to prove why you would be the best candidate, and have a clear and concise resume will assist in that process. Grant proposals. You wouldn't want to be at work and run out of supplies or not have life-saving equipment. So creating grant proposals are essential in requesting funding for those everyday necessities. No matter the amount of your grant proposal request, your goal is to have the funding awarded. So making sure your plan is concise and edit your proposal at the end. Also, everyone wants raises, or they want to be allowed to get overtime hours and more benefits. Those things also cost money for hospitals. So someone is responsible for formally requesting those funds. If your proposal isn't direct or doesn't provide a reason why your proposal takes precedence, then your proposal could be rejected. That's why it's so important to properly take the time to construct a proposal. As for qualifications, besides having a registered nursing license or degree, jobs seek out qualified applicants to fill their positions. Nurses need to incorporate technical writing skills when writing in patient charts, discharge instructions, and creating reports. It's important that your patient has a clear understanding of their post-procedural aftercare instructions. You also want to be accurate and thorough when explaining to another nurse or doctor the signs, symptoms, and medications given to a patient. Remember, someone's life is at stake, and not properly documenting something could be a bad miscommunication. It's also important when reporting services rendered to the patient during their stay at the hospital. Registration needs to know everything performed without confusion so they can accurately bill the patient's insurance. And lastly, for patient communication, it's important to have the ability to professionally communicate with your patients, their families, and their colleagues. You want to sound professional, knowledgeable about the subject, and be able to convey a plan of action for treatment of procedures. You also want to be able to accurately communicate of the doctor's or surgeon's notes to the patient. Communication is also remembering who you're talking to, about what, and when. It's important to use an appropriate tone of voice, especially when giving test results. You don't want to sound too emotional, but still seem like you care and understand. And this is my works cited, and here I have my interviewee listed as well, along with my images and the remaining of my research cited. Thank you. If there's any further questions, please feel free to email me at my TCC email. Thank you.